Ribble Rivers Trust are an environmental charity who are based in the northwest of England, and our aim is to improve rivers across the Ribble catchment for wildlife and for people. And there are a few things that underpin a lot of what we do at the Trust. So firstly, we use data and evidence, which is largely in the form of GIS data, to prioritise where our works are most needed and where they could have the greatest benefits. And that includes a range of data that we collect ourselves, but also quite a lot of open source data as well. We also work collaboratively with a wide range of partners to deliver holistic projects that have a range of benefits. And we try to involve local communities as much as possible in our work, wherever it's feasible. So today we're going to very briefly talk about why we're trying to deliver environmental benefits that also have health and wellbeing benefits as well. And we'll look at where our work in collaborating with others on this started, how it's been evolving, and what we're collectively trying to achieve. And we'll look at how GIS has been used to guide this work so that we focus our efforts in the places where they're likely to be most beneficial. So why, as an environmental charity, are we trying to incorporate health and wellbeing into our environmental work? And why are we trying to work with other organisations to do this? Quite simply, it's because we can achieve so much more for both people and the environment by involving local people in our environmental projects and working with others to do so. Firstly, inactivity, obesity and the health issues that they can lead to put a huge strain on the NHS. So this slide shows that NHS research has found that physical inactivity costs England's economy about £8.2 billion a year. Secondly, it's now very well evidenced how access to blue and green space, so those outdoor spaces with water and greenery, can have a positive impact on health and wellbeing. And that became just so apparent during the COVID lockdowns when everyone was just desperate to get outside. And thirdly, the more connected people feel to nature, the more likely they are to want to protect it. So by getting people involved in local environmental projects, the environment benefits from having those extra pair of hands that are helping out with those improvement projects, and hopefully some of those people are going to be more emotionally invested in the areas that they've been working in, and so they're more likely to want to look after them going forwards. And the people themselves receive the health benefits associated with carrying out that outdoor physical activity that is contributing to something positive environmentally. So where did our work begin in terms of incorporating health and wellbeing into environmental projects? It was in 2019, and Ribble Rivers Trust started working collaboratively with the Environment Agency and also Lancashire County Council's Director of Public Health on a project that we called Connecting Communities with Natural Capital. So essentially connecting people with what nature has to offer them. And our aim initially was to pool our respective expertise to develop and trial a business model for how a relatively small amount of investment by public health bodies could be used to generate much greater funds to deliver projects that benefit the environment and people's health and wellbeing at the same time, which could hopefully in turn reduce the strain on public health services. However, the onset of COVID-19 did press pause on those discussions because understandably there were much greater concerns at the time. But it did pave the way for subsequent work in this area, which is what we're going to look at today. And as part of this project, I carried out a GIS analysis to help us to prioritise where investment into the environment could have the greatest health and wellbeing benefits for people across Lancashire. I did this using desktop ArcGIS, and I made use of data that has been produced by leading environmental and health bodies in England. And the analysis identified key locations where people had poor health and wellbeing, so these are the red areas on the map, where the environment is likely to be negatively impacting on people's health and wellbeing, which are the blue areas on the map, and where there was an overlap between those two risk factors, so where the red and the blue areas on the map overlap. The Rivers Trust, who are the national umbrella body for local rivers trusts such as Ribble Rivers Trust. I've worked there for 7 years, it never gets easier to say Ribble Rivers Trust. The Rivers Trust recognised that the analysis and the resulting data layers could be useful beyond Lancashire and to a range of organisations. So last year they provided funds for the analysis to be updated and extended across the whole of England, and again did that using ArcGIS desktop software, and again using open source data from leading health and environmental organisations. And we published it as a decision support tool online in the form of an Esri story map that anyone in England is able to use. And the data sets within that decision support tool detail the levels of inactivity and obesity and associated illnesses such as depression in local populations. They detail where people have a lack of access to green and blue space, or where the environment is likely to be negatively impacting on people's health and well-being. The data sets show other factors that could help you to figure out why there are high levels of issues in certain populations, such as the population demographics. And it also contains data sets that could help you when planning potential projects to address those issues, such as the accessibility of sites by public transport, or which GP practices cover a certain area, so you can contact them to perhaps talk about a green prescribing project and so on. So the aim of this decision support tool is to help organisations to determine where improving the condition of and increasing people's access to green and blue space could have the greatest health and wellbeing benefits for those that are most in need. So we have a range of data and evidence in the form of GIS data and local knowledge that tells us where the environment could benefit most from interventions. We've got a large number of organisations who each have plans for how they want to improve the local environment and have experience of doing so. We have existing successful mechanisms for integrating the public into environmental activities. And now we have this decision support tool that can help us to identify where local populations could most benefit from either getting involved and getting outside and active and helping to deliver some of these projects, or from having better access to these high quality blue and green spaces that they can use for outdoor recreation. So if we design our environmental projects in the right way to factor in the needs of both the environment and local populations, we can address multiple issues with one project. And we can use GIS to help us to find potential solutions to those problems, which is something that we're always really keen to do. And happily for us, along came the Green Recovery Challenge Fund, which is a fund set up by the government to help the country to recover from the impact of COVID-19. And it aims to kickstart environmental renewal while creating and retaining a range of jobs. And this fund was just a perfect fit for the types of work that we were wanting to do. So we pulled together a partnership, which is shown on this map, and together we developed and submitted an application to the Green Recovery Challenge Fund for a project that we called Health and Environmental Action Lancashire, or HEAL for short. And collectively, we decided that the aims of the HEAL project should be to connect people with nature, to protect species, to create and restore habitats, and to safeguard and create environmental jobs, all with a focus on disadvantaged communities and those with long-term health conditions. And the partnership consisted of a range of organisations. So there were those who know what the local environmental issues are that need addressing, those who are experienced in delivering the types of work needed to address those issues, those who are experienced in working with local communities to deliver environmental projects, and landowners such as Lancaster Uni and local councils who gave permission for projects to happen on their land, but also organisations who have a good working relationship with the farming community and who gain permission for projects such as woodland creation to happen on private land as well. There were partners in the partnership who are good at writing funding bids and evidencing the need for projects, and those that have a great network of contacts who can be called upon to help to deliver aspects of the project should the application be successful. So collectively, we used our diverse skill sets, our knowledge and contacts to pull together a list of projects across Lancashire that the evidence suggested could benefit the environment and people. And the brilliant news is that the application was successful and we received funding for the HEAL project last autumn, and the project will last 18 months. And so we'll just briefly look at a few of the individual activities that are happening as part of the project, but we can't cover them all because there's quite a range of things that are happening. So one of the individual projects is the improvement of a place called Pleck Meadows, which is in Accrington in Lancashire. So Hyndburn Borough Council own the land, and they'd previously carried out vegetation surveys to identify key priorities for habitat restoration. But we could also see from using that decision support tool, that story map, that there are issues with obesity and depression and inactivity and deprivation within nearby communities. So collectively, we could see what the combined issues were within Pleck Meadows itself, but also the community surrounding it. And so we were able to weave together a project that could tackle all of those issues together. And so the project here aims to improve and diversify Pleck Meadows habitats, to improve it for wildlife, to increase its capacity to aid natural flood management, and to increase accessibility of the site to local residents. And the aim is to involve local communities in delivering some of those works. And we're delivering those works as a partnership as well, drawing on our respective strengths and experiences. So if we look at just one particular area of Pleck Meadows, there's another environmental charity called Prospects Foundation, and they are delivering some meadow management, and they aim to include local volunteers in this meadow management work. Within that meadow, Ribble Rivers Trust will be creating a series of wetlands, and we're going to be carrying out some community consultation to shape the design of those wetlands. And then Hyndburn Borough Council are creating a new footpath that is accessible to all users that will take in both of those habitats. So we're heavily involving local communities in the delivery of these environmental projects that will in turn create a nicer environment for them to use. Another one of the projects, there are 3 charities in the partnership who are running a series of health walks across Lancashire in our respective areas of operation. So we're aiming to reach local people who have health and wellbeing issues that could benefit the most from these walks. And because of this, the HEAL partnership is actually expanding all the time, because we're now working collaboratively with local NHS neighbourhood teams and social prescribers and other organisations who can advertise these walks or refer people to them and help us to reach those target communities that we would really struggle, I think, to reach otherwise. And we've been running general health walks for a while now. There are some people who attend regularly, and so, for example, there are some who are recovering from injuries, and they're saying that actually they're seeing they can walk further now because they're going on these walks, and there are others who don't feel safe walking on their own anymore, but they're really happy to have been able to join a group and walk in a social setting and make friends by doing so. And so we're already seeing the health and wellbeing benefits that these walks can have on attendees. And some of these health walks have a focus on collecting local provenance tree seeds, so seeds from native trees that grow naturally in the area rather than being imported and planted by humans. And so those trees and the seeds that they produce are adapted to local conditions. And those seeds that are collected on these health walks will go into our community tree nurseries, which we'll come onto in a second, and the tree saplings that grow in those nurseries will eventually be planted into new woodlands. I've created an Esri story map to help us to identify potential locations to go on these seed collection walks. So we've used the story map to identify where there are ancient woodlands that are close to populations that have the greatest issues with health and well-being, and where those ancient woodlands are likely to be more accessible to people with a range of mobilities. And it's also helping us to see the key areas where we need to get in touch with health and wellbeing organisations to help us to reach those target communities. And this story map is an easy way to communicate the data to partners that are also working on these health walks. And it ensures that we're being consistent in how we're using data and evidence to plan the walks and maximise the desired outcomes of the project, which is to reach those target communities and collect local provenance tree seeds. And actually, the other partners who are running the health walks, they don't use desktop GIS. And so having access to an Esri story map makes the data available to them when otherwise it just wouldn't be. So those tree seeds that are collected on the health walks will be sown into 3 community tree nurseries across Lancashire, and the trees will eventually be planted out into new woodlands by the partnership, because collectively we plant tens of thousands of trees every year. And again, a range of health and social organisations are helping us to reach our target audience, who are people with issues that could really benefit from the gentle form of exercise that's involved with working in these tree nurseries. So we'll be training local communities to run the nurseries, and that means it's more likely that the nurseries will remain up and running beyond the end of the project funding, which is next March. Those volunteers might learn new skills, and I've overheard volunteers talking to each other about how therapeutic and how mindful they're finding working in the nurseries, and I haven't prompted them to say that, I've just overheard them talking to each other. And then in a couple of years, the partnership will have some trees that we know are local provenance, and we can use those to create new woodlands that will provide benefits to the environment, and so there's benefits for everyone here. Last example, Another collaborative part of the project is between Ribble Rivers Trust and local schools. So the aim is to deliver a series of educational sessions designed to connect children with nature, to improve their well-being and to get them carrying out tasks that improve their local environment. So that decision support tool, that story map that we keep coming back to, was used to identify 2 areas of Lancashire where there are the greatest issues with inactivity in children, excess weight in children, and also where local populations don't have enough access to green and blue space. And so these are the areas where school pupils could most benefit from being encouraged to be active in the outdoors. And not surprisingly, those priority areas were in urban areas. And this helped us to determine which schools to try and approach first. And 8 schools from those areas have signed up to the programme, which is fantastic. So each school in our water and wellness programme, as we're calling it, receives 6 sessions, and they include a walk to the local river, they learn about the importance of trees, they do mindful activities, and they carry out litter picks and plant trees, and so on. And feedback from the teachers so far has been, we're only a little bit of the way through this project at the moment, but feedback from teachers has been that often they themselves are not local to the area that they're teaching, and so they don't know what green and blue spaces are nearby and available to use, and they just don't know where to begin in terms of taking their pupils outdoors. And so this project is helping them to learn and gain confidence in taking children to these spaces and using them to learn. And also the pupils just didn't know that the local river was even there, or that there's a park just down the road from where they live, and they're now really keen to take their families to those places. And so they're being encouraged to access the outdoors more, and they're experiencing how connecting with nature can lead to positive feelings. So we're helping the pupils to receive health and wellbeing benefits of connecting with nature, and we're helping teachers to learn how to do the similar thing going forwards. And they are helping us to improve the environment by picking litter and planting trees. And the children's newfound connection with nature and their experience of how it can lead to increased well-being will hopefully encourage them to continue to protect it in the longer term. So that decision support tool, the story map that I keep mentioning, that details where local populations have real issues with health, well-being and environmental pressures, has really added value to our HEAL project. It's enabled us to adapt our environmental projects to ensure we involve local people so that the projects benefit the environment and people. And this evidence base covers England. It is available for anyone to use, and it's available in multiple formats, all of which you can access via the Rivers Trust's catchment-based approach data hub, the link for which is on the screen. You can view the data sets online on that interactive story map. If you have ArcGIS online, you can add the data sets into your own online maps, or if you have desktop GIS, you can either download the data or pull it directly from the web and display it on your desktop GIS. And there is a recording of a webinar on there that introduces you to the evidence base. And I am happy to discuss any of this with anyone, or also what other sources of open data are out there if anyone would find that useful. So in terms of the value that ArcGIS adds to our work, it enables us to pull data and evidence together to help us to target our efforts where they could provide the greatest benefits in a way that we just wouldn't be able to do otherwise. And there's a lot of open data out there that could enable anyone else to do the same. And ArcGIS Online and Story Maps help us to share data with partners who otherwise would have no way of accessing the data, and it helps them to ensure that they can also use the data to inform decisions. And it has enabled us to share this England-wide evidence base that we've created that could be of use to others. And in terms of working with partners to deliver any type of project, a tip is it does take time to build a good partnership, so start engaging with potential partners early, and it will help you to just hit the ground running when a project eventually starts, and it'll help you to achieve so much more in that project. And having a diverse partnership means that each organisation brings different knowledge and skills and experience and contacts to the table, which can really add value to a project. And you can learn so much from each other, and that can help you with other projects as well. And it can also help to spread the work out between the partners, so collectively you can achieve so much more than if you were working in isolation. And in general, what we found is that with a bit of careful planning, it isn't that difficult to integrate local people into our environmental projects and to see the benefits that it has on those people. And there does actually seem to be a lot of interest in the moment in these green volunteering opportunities. So if it's something you're thinking about, I think now is a really good time to really start investigating, actually doing it. So I think I'll leave it there. Thank you very much for listening.